The outbreak has now overtaken the country's devastating 2018 to 2020 epidemic, making it the second largest Ebola outbreak ever recorded worldwide, after West Africa's outbreak in 2014 to 2016. As the UN reports clashes in the South Kivu territories of Uvira, Fizi and Mwenga.
Access to healthcare has been particularly impacted, with damage to health facilities and the departure of medical personnel limiting the availability of medical care in affected areas. These developments come as efforts to contain the Ebola outbreak continue in the province. We reiterate our calls on all parties to protect civilians, facilitate safe and sustained humanitarian access, and restore telecommunications, which remain critical for civilian protection, public health efforts, and humanitarian operations.
Is centered in eastern Congo, where conflict, mass displacement and overcrowded camps are making it much harder to stop the spread of Ebola. This week, UN partner, the International Medical Corps, is opening the country's largest Ebola treatment center, adding 100 beds to the response. But the World Health Organization says far more resources are needed to get ahead of the outbreak, warning that insecurity and population movements continue to give the virus new opportunities to spread. Officials briefed the media from Bunia last week.
In support of the government, I'm calling that we step up, across the response, be it the United Nations, non-governmental organizations, member states. We need to massively step up our response, be it in terms of supplies, specialized supplies like personal protective equipment, staff, specialized medical staff, and logisticians. And we call upon member states to keep the borders open so that our staff can travel in to Congo to respond, so that we can bring in supplies quickly and freely, and then when colleagues come out, that they're able to return home.
A deadly epidemic exacerbating a long-standing and dire humanitarian situation in the country's eastern regions.
Is that this situation requires much more attention. And so I welcome this opportunity to speak to all of you. This is the fastest growing Ebola crisis ever, Ebola outbreak ever. To make a comparison, in the past 2 months, 1,000 people have died. That took 8 months for 1,000 people to die in West Africa. So that means that there is a fourfold in terms of the number of deaths in this short period of time. And I think that itself requires world attention.
Scow tried to convey the complexities of the situation.
You may think that it's just about treating the identified patients, but no, this requires, from all the experience we have, a broader set of tools, and that includes food. We cannot isolate patients unless we provide them also food. We cannot have health workers working around the clock in these dangerous environments unless they're also being fed. And frankly, we also have whole communities who have been closed off and that we expect to remain in their homes, and they also need to be fed.
10 million people are acutely food insecure in eastern DRC, and to sustain all operations in the country for the next 6 months, WFP requires over $293 million, which includes funding for emergency logistics and food assistance in Ituri and other affected areas. Sherwin Bryce-Pease, SABC News, New York.